Hello, I'm Dr. Tabor Smith. Welcome to the Spinal Hygiene podcast. This is our first episode. I'm so happy to have you on episode 1. We're going to be talking about a devastating problem that really, not just in our country, but all over the world. We call it the Silent Epidemic, or AKA Spinal Degeneration. We're going to jump into that specific topic and really get into, in today's episode, the reason why we started this podcast, the reason why spinal degeneration is devastating for you, devastating for your family, and if we can't say the word, quote unquote, preventable, at least we can say, look, there are some things we can do to lower your risk of spinal degeneration. And you have to know, first of all, how big this problem is. In fact, statistics show 96% of our population will have spinal degeneration by the age of 80. On top of that, 60% of people will have spinal degeneration by the age of 50. Now, I know you're saying that isn't spinal degeneration just arthritis? Isn't it just come with old age, that when you're 50 years old, 60 years old, 80 years old, that you just have spontaneously this degeneration of your spine? And the answer to that is absolutely not. We can look at textbooks, but Managing Low Back Pain by Kirkcaldy-Willis says that that degeneration is not caused by age. Rather, it's caused by damage of the joint, wear and tear of the joint. And so there are some specific things. If we can find out what causes spinal degeneration, ladies and gentlemen, we can give you the best chance possible to prevent spinal degeneration. So you're looking at this question, this age-old question, is arthritis just caused by old age? Well, now we've answered that question. Science has answered that question. Recent studies show that 37% of 20-year-olds in our society have spinal degeneration. 37% of 20-year-olds. 20 is not old, but because of our sedentary lifestyle, because of wear and tear, because of video games, computers, cell phones, we're in degenerative postures all day long, and so we're speeding up this process of spinal decay, spinal degeneration, and so 37% of 20-year-olds. By the way, if you want the research, if you want the specifics on where I got these numbers, check the show notes. I'll make sure that we reference those in there. But look, even if you're saying, well, I'm already 30, I'm already 40, it's too late for me. It's not too late. And in fact, now is the time, if you have kids, to begin taking precautions and trying to prevent this spinal decay and this spinal degeneration. Because a recent study out of Switzerland, scientists took and did a group of 10-year-olds. They did MRIs on these 10-year-olds, and they were looking for changes in the spine, like arthritis, like degeneration. All these 10-year-olds were asymptomatic. That means that they did not have a pain in their body. But because of their sedentary lifestyle, because of video games, computers, and the way we are today, 9% of 10-year-olds had spinal degeneration, and they didn't even know it. That's why we call it the silent epidemic, because you don't feel it, you don't see it, and all of a sudden it's too late. It's one of the leading causes of back surgery in the United States right now. And let me tell you this, most of the back surgeries average $100,000 per surgery. So you wonder why healthcare, you wonder why our medical system is the #1 cause of bankruptcy, because these surgeries are outrageous. They're expensive. And now there are further studies that show that back surgery failure is so high. One study of work comp, or people who were injured at work, studies showed that 74% of those surgeries failed, which means they had to have another surgery, and they were on pain pills. You wonder why the pain pill industry in the United States alone is an $86 billion industry. So with all of this money going into the pharmaceutical companies, going into the hospitals, going into surgeons, why would they implement any type of preventative measures if it's silent? If nobody knows it's there until it sneaks up on you and it kills you, literally. I mean, we talk about heart disease, we talk about cancer being silent killers, that 3 out of 5 people in the United States will develop heart disease or cancer, and those things, they're a degenerative disease. But now, look, 9 out of 10 people have spinal degeneration or will develop it in their life. So it's even bigger in some cases, in some measurements, than heart disease or cancer. So in this podcast, guys, we're going to be able to implement some strategies to help you prevent these types of measures. This has already been done, and it's been done successfully in the world of dentistry. If we look back in the early 1900s, we had the exact same thing going on with people's teeth. Okay, and we talk about the numbers of 80% of people or 85% of people having spinal degeneration by the age of 50. Back in the early 1900s, you're looking at 80-90% of people losing their teeth by the age of 50. We had dentures that people would have to wear every night. They'd take out their dentures and then they would go to sleep. And one of the reasons was because of our lifestyle. In the early 1900s, there was an influx of processed sugars, so people's diets were worse. We were getting cavities all the time. And dentists were just pulling teeth. That's all they did, right or left. Dentists, if you went to the dentist, they were so busy pulling teeth, they couldn't really do anything else. So a dentist by the name of Dr. Alfred Phones, who is now known as the father of dental hygiene, he said something has to be done. We've got to stop this process of tooth decay. And they found out that bacteria that builds up in the teeth releases an acid, a byproduct of acid that degenerates your teeth. So he said, well, look, if we started taking care of people's teeth better, if we started brushing, flossing, doing things on a daily basis to prevent the cause, then maybe we can prevent tooth decay. And so they did teeth cleanings in their office, they promoted toothbrush and floss, and dentistry went on a worldwide effort, a grassroots effort to share dental hygiene with the world, and it was successful. They got into our schools, they got into our businesses, and they shared these concepts. And they used deductive reasoning, just like we're going to do on this show, on this podcast. We're going to take and we're going to say, well, what causes spinal degeneration? And if we know what causes spinal degeneration, which we do, then by deductive reasoning, we could be able to lower your risk for it. It's the same thing that dentists do. They know that if they know what causes tooth decay, then by deductive reasoning, if you brush and you floss and you're preventing the cause of that tooth decay, then you have the best, and it's not guaranteed that you're not going to have a cavity, but you have the best chance of preventing that type of tooth decay. All right, so stay tuned for this podcast. Stay tuned for the next episodes because we're really going to dive into what causes it, why people just keep chasing back pain and they never actually correct or address the problem. But in today's episode, I just wanted to lay down the framework, let you know just how big of an issue this actually is, and why I truly believe that the Spinal Hygiene movement, the Spinal Hygiene podcast is what we need to get out and reach more people. So please share it, like it, go to homespinalcare.com is going to be our website. And we'll be doing a lot more of these episodes here to come. But the silent epidemic, ladies and gentlemen, is spinal degeneration. It's one disease that you absolutely want to prevent and do everything that you can before you actually get it. All right, thank you. We'll see you on the next show. Stay tuned.